Good afternoon, and thank you for joining us again today. I'm Dr. James Jarvis, Clinical Lead for the Incident Command of Northern Light Health's response to COVID-19. Once again, joined by Mr. Paul Boland, Senior Vice President of Human Resources for Northern Light. And so we're proud to have you guys with us today. I have a few comments, and then Paul does as well. First comment I have to make really has to do with people's health care. We want to make sure that those of you who have chronic illnesses or have acute illnesses are not neglecting them simply because of fear of the COVID-19 crisis. We need to continue to take care of one another and take care of our chronic illnesses and our acute illnesses as if we were doing that at any other time. That is incredibly important. We have made safety measures across our institutions in order to make sure that we can keep you safe when you do need to seek care. We've also had other safe options, such as video conferencing and teleconferencing that you can do with your providers. So we ask you that if you are having health concerns, that you do reach out and that you are taking care of your chronic illnesses. We continue to do routine surgeries. We have just stopped those elective surgeries in order to limit the number of individuals at our facilities. We still have babies being born. We continue to provide chemotherapy for those with cancer and other treatments as well. And so we want you to understand that we are open and ready and need to take care of you when you need us. And so that's why we are here. I did want to go over some of the numbers for us. For Northern Light Health, we have 11 confirmed cases of COVID within our facilities. The majority of those are still being taken care of by home care and hospice at people's homes. And presently we have 4 confirmed cases being taken care of here at Northern Light Eastern Maine Medical Center. I do want to remind people that we need to be doing the things that can keep us all safe. Doing good social distancing. We are strongly encouraging people to heed the recommendations of the CDC to wear face coverings when they are out in public, and particularly when they visit us in our facilities. And then, of course, doing the good hand washing, good cough and sneeze etiquette, and doing things to keep our surfaces and our areas safe. And with that, I'll turn it over to Mr. Paul Boland.
Thanks, Dr. Jarvis. Part of the communication that we have at each of our facilities will be some new signage that will indicate that a face covering is required in our facilities by anyone over the age of 2 years old. The intent, of course, is to point out by some of the signage that a traditional medical quality mask is one thing that our caregivers would be provided throughout the course of their work and working with patients. But a scarf, a bandana, or a cloth homemade mask is perfectly appropriate for community members coming into our facilities. The intention is to provide some barrier to protect others, and that's what the cloth and scarf type of masks, scarves, and bandanas would provide, and that again is protecting others in the community from the wearer. Dr. Jarvis?
Before we start questions, we had gotten a few questions from the media and from some of our patients that I wanted to address before we took your questions. The first one was, who can get COVID-19 and who should be worried about it? And we've heard from younger individuals, oh, this is a disease we only have to worry about when we're older, so not an issue. And that is not true. Anyone of any age can be infected by COVID-19. And while it is true that those over the age of 60 and those with other chronic medical conditions, particularly heart disease or lung disease, are more susceptible to severe complications from COVID-19, but anyone of any age can catch this disease and certainly can be infected with it and not know it and then spread it to those who are at most risk. So we want everyone to take this seriously. And then we continue to get questions about what happens when we get packages in the mail or we pick things up from the grocery store. And while there is a possibility that there can be spread from this, it is highly unlikely. If you are concerned, the best thing to do is to wipe down those packages after you bring them into your house, and then make sure that you practice good hand hygiene. Similarly, when we go to the grocery store, if you feel more comfortable wiping down packages before utilizing them, go right ahead. I will tell people that it is not proper for you to try to disinfect your vegetables or fruits. They should just be washed off with water like you would any other time to clean those off. Using soaps or harsh chemicals not only would damage the product, but also can make you ill when eating them. So please, just normal care for your fruits and vegetables. And with that, we'll open it up for questions.
Okay, it looks like first on the list is going to be new Citramate. And I believe that's Jeffrey's iPhone, so I'll mute you, Jeffrey, and go ahead.
Good afternoon, Dr. Jarvis. Thanks for taking the time out to talk to us. Question for me is, and I know you're dealing with relatively lower amount of cases in some of the other parts of the state. Do you see any pattern of transmission in the congregate settings? Is it family, one-on-one transmission? And how does that matter to you guys? Where do you go once you learn that information?
So that's an excellent question. The question was, have we seen a pattern in the way we've seen the infectious cases in our community? And so really the only pattern we've seen is in two areas. One would be in those congregate living situations, particularly our long-term care facilities or nursing homes. And so we've seen outbreaks in several of those across the state, and that's pretty common. We've seen that nationally as well. In addition to that, we have seen some clusters in families, particularly when they have gotten together for a particular event and someone was ill, and then seeing that several other individuals within that family become ill. And again, that really has to do with those close quarters and not practicing good social distancing. When we're in our home, we feel safe with our family members, but if one of those family members is infected, if we're not practicing good social distancing at home, it's easy to spread that disease within a household. Beyond that, we have not seen any particular patterns that I am aware of that would lead us to trail down one particular path or another. I will state that every positive case within the state is reviewed by the state CDC, and they do tracking to see if they can figure out where the contact was for a number of reasons. One, so we can monitor what you've just asked about, and two, so that we can alert individuals that they may have been exposed, similar to the process that we use if one of our healthcare workers was exposed at work.
Are you all set, Jeff? Do you have anything else? Sorry, Jeff, somehow you got muted. Do you have a follow-up question, or are you all set?
I am all set. Thank you, Dr. Jarvis.
Thank you, Jeff.
Okay, next up, we're going to go to Penobscot Bay Press. I believe that is L. Landrigan, if I'm not mistaken.
Yes, you're not mistaken.
Hold on. There we go. It's Leslie, right? Is it
Right.
Leslie?
Yes, Landrigan, you pronounced it right. I have a question for Dr. Jarvis, which I think I've asked before, but I'm wondering, what is Northern Light doing to expand testing? It's pretty clear that we won't be able to reopen the economy until we can do more testing.
So we're working every avenue that we can. Northern Light Health Lab has increased its capacity over the weeks steadily, and we continue to work on ways that we can continue to do that. We are hopeful that we can acquire another machine in order to run more tests at the same time. In addition to that, we are looking at our partners around the state, particularly with some of the other laboratories around the state and some of the universities, to see if we can expand testing in that way. And then we continue to communicate with the other health systems across the state and the main CDC to see what we can do in a collaborative measure. The biggest problem continues to be, though, we just don't have enough of those testing kits or the testing reagents, and that is a limiting factor for us to expand out beyond that first tier of our tiering system.
Thank you. Dr. Jarvis, I wonder if you could explain what the difference is between a testing kit and a test.
Yeah, so the testing kit is the actual swab that we use to actually run the test, or to collect the test, I should say. And so that includes the swab and then the cylinder that the swab goes into to bring it to the lab. Then the lab actually has to have a machine that runs that, and that machine uses chemical reagents to do the processing. And so all of those pieces are limited supply. And so if any one of those areas is hampered through supply chain, then that hampers our ability to run any particular test. Right now we're doing very well with the test kits, but reagents and the machine itself are limited and do limit the amount of testing we can do at any particular time. Thank you.
Thank you for your questions, Leslie. Next up, we're going to go to Brianna at WABI.
Hi, again. Thank you so much for doing this all the time, Dr. Jarvis. You're really great at it.
Well, thank you, Brianna. I think the people in the room will tell you I probably don't need my head any bigger than it already is. So.
My question is regarding symptoms. We've kind of heard the same thing, like a dry cough, and you maybe have trouble breathing, a fever, but I think some new ones floating around online. They might be myths people are talking about, they may not be. Have you seen any different symptoms or heard of any different symptoms?
So predominantly the cases that we've seen across Northern Light are really been the ones that you kind of described there. Most individuals have had a fever at some point during their illness where they require hospitalization or seeking care, but it tends to be the people with that dry cough. It is true that this particular virus sometimes causes people to, while they have no symptoms, have actually had what we call hypoxia, or a low oxygen level within their blood, and that's the first telltale sign, but it's something that we can't test for until we actually see you in person. There are some other strange things that have been happening with this virus that we've seen more across the country than we've seen here within the state of Maine. In particular, there's some concern that people start developing blood clots, and again, these are the individuals who are critically ill, not the people who have the mild illness. And then there's a couple of other small, rarer things that we've heard of. But most of the time, these cases are still being picked up with people who are presenting with fatigue, that dry cough, and most likely a fever.
Okay, thank you.
You're welcome.
Okay, thank you, Brianna. Next up, we're going to move to Charlie Iacocca with Bangor Daily News. Just give me a second to unmute your mic, Charlie. Looks like you're all set.
Okay. Hi, Dr. Jarvis. As always, appreciate your time.
Thank you, Charlie.
And this question is for you. Can you tell me what as Northern Light looks to, I guess it's sort of twofold, what types of services are kind of most priority to start bringing back in an in-person form as the concern about exposing patients to the coronavirus wanes a bit, and then when do you think that could happen? Do you have any better sense when those types of services could resume more? And I'm thinking in particular about screenings for kind of just routine screenings like colonoscopies and mammograms and things like that, but if there's anything else that comes to your mind, I'd like to hear about it too.
Yeah, so Charlie, that's a great question. So the question is when do you think that we'll start doing some of those more, quote, routine kind of procedures and testing at the medical center and across Northern Light, and what would be the prioritization of that? So really it starts coming down to urgency. So what is the most urgent kind of thing that we need to do? So we do know that we did put off some people who did not need to have emergent cardiac procedures, and so starting to bring those individuals in. Certainly we have been managing where we have individuals who need to have like biopsies done to rule in or rule out cancer, and we've been bringing those individuals in on a limited basis. But our first priority is going to be bringing in individuals where we have purposely delayed some of the more urgent types of procedures, but we can't continue to wait on them. Cardiac procedures are the one thing that comes to my mind. When we start talking about more screening things like colonoscopies, mammograms, those are going to be things that will probably be in the last phase of us opening up. Why? Because those are things that we can put off safely, and again limit the number of individuals coming to our facilities, and so those will probably be the last thing that you'll see come online. More important that we get those urgent procedures in place.
This is Paul. I have a follow-up to Dr. Jarvis's comments. Part of the planning for resuming those procedures is the staffing for those. And so a number of the areas where we have staff, both clinical and support staff, that have worked in areas that have been curtailed due to changes and reductions in elective procedures and the screenings that Dr. Jarvis just spoke about. Many of those employees have been retasked and reassigned for COVID response, COVID swabbing stations, nurse triage lines, and the like. And so part of our assessment with our workforce is also to identify who on the COVID front lines will be utilized first to go back to their regular employment, and then cross-train others to take their place to continue the COVID work that's going on. So it's a very orchestrated and deliberate operational challenge that we're working through right now.
And I just want to add to that Northern Light will not be doing this alone. We are working in concert with our colleagues at the state, as well as across the state and healthcare systems and hospitals across the state. Northern Light is very fortunate to have individuals who are working on several of committees that are looking at how we can reopen not just our healthcare but our economy. And so it's important to understand that we do work with our partners and that this will be a very group effort.
So, Charlie, you were a very loud typer, so I actually muted your mic because we could hear it over the screen. I'll unmute you now if you have a follow-up question.
Oh, sure. Then very understandable. Sorry about loud typing. I guess it was just, maybe you don't have an answer, but do you know when some of those procedures might be when you'll start reincorporating some of that stuff back into the normal operations?
So Charlie, yeah, it's a good question. The question is when, and I think that is the question of choice right now. We do not know. Sooner that we can do that, the better, but more important is for us to do it in a safe manner, and that will require us to know more information about the virus, and will require us to be seeing numbers not just flatten and plateauing like we've seen recently, but to actually going down, so that we know that we're not contributing to the problem by having people come into our facilities. It won't be this week or next week, but hopefully we'll start being able to increase the services that not only we can provide, but others can provide in the coming weeks. But we want to do that in the most safe fashion as possible.
And in addition to that, Northern Light Health, in addition to Maine Health and the other two systems throughout the state, are working collaboratively with Commissioner Lambrew and the Governor's Office in working through some of these details to understand what would be clinically safe and appropriate and how do we go about this. So it's a very broad-based collaborative effort to identify how to go about this to restart not only these procedures in healthcare but the economy in general. And so we're looking forward to that collaborative effort bearing fruit very soon.
Thank you very much for your questions, Charlie. By the way, no need to apologize. I'm a loud typer too. Next up, we're going to move on to Amy Brown with WERU, and just let us know who your questions direct. And go ahead.
Thank you. This is for Dr. Jarvis. Thank you, Dr. Jarvis. Is Northern Light Health anywhere in the system participating in any clinical trials?
For COVID-19, not at this time. We do have a process for if we were to join in any clinical trials. We have explored those, but right now, because of our low volume, those trials, particularly those that are involving treatment, do not fit our needs. But certainly, we are looking into opportunities where maybe we can look into whether or not we can participate in some of the trials for people who have recovered from this disease. But currently, we are not in any kind of clinical trial, but continue to look into that.
Okay, and how about antibody testing? Is that being done at all in the state?
No. So right now, I am not aware of any being done in the state, and certainly not by Northern Light Lab right now. The antibody tests out there, while they may have had been waived the approval process for the FDA, there is none that are approved yet by the FDA, and there are lots of those tests out there right now that are being looked at, but nothing that's of any clinical value. And for right now, for Northern Light Health, we would have to be looking at one that had a clinical value, and so not currently.
Okay, thank you very much for your questions, Amy. And last but not least on our list today is Fox 22 WBII. And I believe it might be TJ today.
It is, Chris. Thank you. First question is for Mr. Bolin. I'm wondering if you can tell us the comparison of the economic stream today as compared to January and February of earlier this year.
So the question is the economic stream for Northern Light Health, I assume, in terms of revenue.
Yes, sir.
So I don't have a detailed number to share in terms of impacts to our revenue. Clearly, it's been impacted. We've got financial planning in place to deal with disasters and incidents such as would happen throughout the course of normal time, but COVID is something that's very different. Also, what makes it very hard to understand the full financial impact is the various programs, both state and federal, that impact reimbursement for hospitals and healthcare providers. And so it's myriad of issues to work through. Our financial team is currently working through that, but I don't have a number to share at this time.
Do you have a ballpark, 50% less now than?
I don't have a ballpark difference in terms of dollars. I just don't have that information available right now.
I understand. Thank you so much.
Sure.
Thank you, Chris.
Yeah, thank you, TJ. Does any, we probably have time if anybody has a follow-up question they want to ask. Is there anybody out there that has a follow-up question? Why don't you just throw me a text in the window real quick. I'll give you a call. And if not, we'll wrap things up.
So Chris, just before we go, I'd feel remiss if I didn't join the chorus of health experts warning individuals do not use things like disinfectants on your own body, and certainly do not ingest any. That would be incredibly dangerous. Those are designed to kill things on surfaces and not for human consumption. And so I implore everybody, if you feel the need to have any treatment whatsoever, please call your healthcare provider.
All right, good advice. Thank you very much, Dr. Jarvis. Thank you very much, members of the media. Those of you who would like a better quality video copy, please let us know and we can make that available to you. Just send me a note in the chat window and we will include you on the list for the Dropbox link, in which we'll have that later on this afternoon.